Seven investigator Ross Jones is talking to patients and hospital insiders who say their calls for help continue to fall on deaf ears.
I've even had patients that tell me they will never seek help again because of their experience at Harbor Oaks. They're like, this place ruined it for me.
Autumn Konworski came to work at Harbor Oaks convinced she could make a difference. But within months of starting her job, the behavioral health technician went from wanting to help to desperately needing it.
I was in charge of 14 people by myself.
On paper, she says Harbor Oaks looks like it's properly staffed. Autumn worked with 2 nurses who were supposed to help her manage her patients. But in reality,
the LPNs pulling meds, the RNs doing paperwork and charting, so on the floor with the patients is one tech.
Chronic understaffing, according to hospital employees, has made Harbor Oaks unsafe for everyone. For years, we've reported on physical and sexual abuses among patients inside the hospital. But recently, according to police records, the violence has gotten even worse. In July alone, 4 patients reported they were the victims of crimes. In one instance, police were called after a woman was repeatedly punched by another patient. Later that month, a man reported being sexually assaulted when another patient with a lengthy criminal history stuck his hand up his gown and grabbed his penis.
It didn't seem like there was enough people to handle all the patients.
In just 5 days at Harbor Oaks, Jacob Osborne says he was involved in 2 assaults. The first didn't leave much of a mark, but the second...
A right hook to my left ear and punctured my eardrum. Totally detrimental. It didn't help me one bit. If anything, I would think they'd want to keep you away from violence rather than push it all together.
In August and September, 3 more assaults were reported, including one where a patient suffered a concussion. And in this video, a Harbor Oaks nurse was attacked by a patient with a known history of violence. This was just one of 3 alleged assaults she committed in just over a month. All told, between July 10th and December 3rd, 13 physical assaults and 1 sexual assault were reported to police.
They're at the hospital for help. They shouldn't end up abused in any fashion. And when it does happen, there needs to be accountability.
Tom Watkins spent years as CEO of the Detroit-Wayne Mental Health Authority, and before that was in charge of the state's mental health system. He says mounting abuse inside the hospital should have the attention of state watchdogs. And yet, when the state's Department of Licensing and Regulatory Affairs has inspected Harbor Oaks, it consistently found the facility to be in compliance. But internal emails show that other state officials felt differently. In the summer of 2018, Dr. George Mellows was hospital director for the Bureau of Health Systems. And in a string of emails with a colleague, he worried about understaffing at Hawthorne Center, a state hospital for children, writing in part, "We must not let Hawthorne Center be the next Harbor Oaks." Dr. Mellows declined an on-camera interview about his comments, but through a spokesman said, Harbor Oaks is not operated by the state and that the state does not have authority over staffing levels.
Harbor Oaks is the responsibility of the state. And certainly somebody going into a hospital and being harmed physically or emotionally, even greater, is just unacceptable.
It was unacceptable to Autumn Konworski. After less than a year at Harbor Oaks, she quit last month, concerned that she couldn't keep patients or herself safe from harm.
Sooner or later, the travesty of the dam will break, and people will say what they've historically said. How did this happen? How did we not know? Well, they didn't know oftentimes because they didn't want to know.
Harbor Oaks Hospital's CEO, Brianna Jacob, released a statement that reads in part, Harbor Oaks takes all incidents and issues very seriously. We address them immediately. We promptly investigate any allegations of abusive behavior among residents and report them to law enforcement, state agencies, and guardians. The safety and rights of everyone in Harbor Oaks, our patients and staff, have been and always will be the hospital's top priorities. You can read Harbor Oaks' full statement on our website right now at WXYZ.com.
Now, Ross, you mentioned more than a dozen allegations. Have any of these allegations to this point led to charges?
Good question. So far, warrants have been authorized in 7 incidents. One other one is being considered. In a number of cases, we saw that victims did not want to proceed with charges, but a number of these cases are proceeding.
I know you'll keep your eye on it. Ross, thank you.